Ever had that feeling? Where your mouth just feels completely dry, like
Right.
a desert.
Oh, yeah, that sticky, uncomfortable feeling. A lot of people experience that.
We've definitely all been there at some point.
Mm.
So today, we're doing a deep dive into exactly that.
Hmm.
Xerostomia.
Which is the technical term for what most of us just call dry mouth.
Right. And it's more than just being a bit thirsty, isn't it?
It really is. When
Yeah.
you don't produce enough saliva, it can cause real issues. Trouble swallowing sometimes, kind of burning feeling in the mouth, which can be super irritating, and it can even mess with your sense of taste.
Absolutely. And you, our listeners, you send over a great batch of sources, articles, notes on this. Really comprehensive.
Yeah, it was a good collection.
So our mission today is basically to pull out the key info from all that material you shared, figure out what might be causing this dry mouth.
And crucially, what you can actually do about it.
Exactly. So let's jump in. One thing that really stood out from everything you sent was how often medications are the culprit.
Yes, that was a very clear theme. Medication side effects seem to be a really, really common cause of dry mouth.
It's kind of surprising just how many different types of drugs can do this.
Yeah.
The sources mentioned things like high blood pressure meds,
Antidepressants came up a lot, too.
and even just regular over-the-counter stuff for allergies or pain relief.
Mm-hmm.
Okay, so maybe we can unpack that a bit. Why do all these different medications treating different things end up causing a dry mouth? What's the common link?
Well, it's interesting. A lot of these drugs, they work in different ways for their main job, but they can sort of converge on the systems that control saliva.
Okay.
Many of them interfere with the nerve signals that tell your salivary glands to, produce saliva.
Uh-huh.
For instance, some might block acetylcholine. That's a neurotransmitter, a chemical messenger that's really key for stimulating those glands.
So even if the drug is for, say, blood pressure,
Yeah.
it can accidentally hit the brakes on saliva production.
Exactly. It's like an unintended side effect, an off-target effect for some people.
That makes sense. So if you're listening and you've got this persistent dryness
Yeah.
and you are taking some medication,
Mm-hmm.
what's the first thought?
Definitely talk to your doctor. That's the most important first step.
Right.
Explain the dry mouth symptoms and make sure you tell them everything you're taking. Prescription, over-the-counter, supplements, the lot.
Because they might not connect it otherwise?
Well, they need the full picture. Then they can check if any of your meds are known culprits for dry mouth. Sometimes there's an alternative drug you could try.
Or maybe just adjusting the dose.
Or adjusting the dose, exactly. That might be enough to ease the dryness for some people. Worth asking about.
Okay. Now, shifting gears a little, another thing that popped up in the sources was a link between anemia and dry mouth.
Yes.
Anemia being, when you don't have enough healthy red blood cells.
Mm.
How does that connect to a dry mouth?
Okay, so think about what red blood cells do. Their main job is carrying oxygen, right?
Right, all around the body.
Exactly. And that includes delivering oxygen to your salivary glands. Those glands need a good oxygen supply to work properly to make saliva.
So if you're anemic, less oxygen gets there.
Precisely. Fewer red blood cells, or less effective ones, means the salivary glands might be starved of oxygen, essentially, and that can reduce their saliva output.
And the sources mentioned other anemia symptoms too, didn't they? Like feeling really tired.
Yes, fatigue is a big one. Pale skin sometimes, maybe feeling dizzy.
So someone's got dry mouth plus some of those other things.
Then it's really important to see a healthcare provider.
Okay.
They can run some simple blood tests to check for anemia, and if that is the issue, treating the anemia itself, maybe it's low iron, maybe something else could actually help the dry mouth symptoms improve too.
As the glands get more oxygen again. Makes sense. Okay, let's talk diabetes. That was another strong connection mentioned in the materials you sent. What's going on there?
Yeah, with diabetes, it often comes back to how the body handles fluids and sugar. A classic symptom, especially if blood sugar isn't well controlled, is feeling incredibly thirsty all the time. Polydipsia, it's called.
Right, excessive thirst.
And that happens because when your blood sugar is high, your body tries frantically to get rid of the extra sugar through your urine.
So you pee more often.
A lot more often. And all that peeing means you're losing fluids, which can lead to dehydration overall.
And less fluid overall means less fluid available for saliva.
You got it. When the body's dehydrated, saliva production naturally decreases.
So for someone managing diabetes and dealing with dry mouth, the focus should really be on, managing the diabetes.
Absolutely. Keeping blood sugar levels as stable as possible through diet, exercise, meds, whatever their doctor recommends.
And hydration too, presumably.
Oh, definitely. Consciously drinking enough water throughout the day is key to counteract that fluid loss and support saliva production.
Now, your sources also touched on something maybe more direct, head and neck radiation therapy.
Yes, that's a different kind of cause.
How does that lead to dry mouth?
Well, in that case, the radiation treatment itself, while targeting cancer cells, can unfortunately damage the salivary glands directly.
Ah, collateral damage, basically.
Sort of. The cells in the salivary glands can be quite sensitive to radiation. That damage can reduce how efficiently they produce saliva, sometimes significantly, and sometimes permanently.
And this is a known side effect for people undergoing that treatment.
Oh, yes. It's a very well-recognized side effect for patients getting radiation in the head and neck area, often unavoidable, sadly.
So for those patients, what's the approach?
It's really vital they talk openly with their cancer care team, their oncologist, radiation therapist.
Because the team will expect it.
They'll be very familiar with it.
Mm-hmm.
And they can suggest specific things to help manage the dryness. Special mouthwashes, maybe saliva stimulants, other ways to keep the mouth comfortable during and after treatment.
Okay. Another condition highlighted was Sjogren's syndrome. That sounds different again, an autoimmune issue.
Yes, exactly. Sjogren's is autoimmune, meaning the body's own immune system mistakenly attacks its own tissues.
And in this case, it attacks.
It specifically targets the glands that produce moisture. So primarily the salivary glands, leading a dry mouth, but also often the tear glands, causing dry eyes as well.
So it affects moisture production more broadly.
It can do, yes. While maybe not as common in the general population as, say, medication-induced dry mouth for people who have Sjogren's, the dryness can be really persistent and quite severe.
Right. So if someone thinks that might be what's going on.
Then again, it's crucial to see a doctor. They can order specific tests, blood tests, looking for certain antibodies, sometimes even a tiny biopsy from a salivary gland in the lip.
To confirm if it's Sjogren's.
Yes. Getting that diagnosis is key because then they can manage all the different aspects of the condition, including the dry mouth.
Okay, wow. So we've covered quite a few potential causes: meds, anemia, diabetes, radiation, autoimmune issues.
A real mix.
Definitely. So let's switch to the practical side. What can actually be done to manage dry mouth? The sources you sent really hammered home, starting with a visit to the dentist. Why there first?
Your dentist is often in the best position to spot the effects of chronic dry mouth first.
Like more cavities.
Exactly. Maybe more cavities than usual, gum inflammation, changes in the look or feel of the tongue or cheeks. They see your mouth regularly.
Right.
So they can do a thorough checkup, assess your overall oral health, and see if there are any obvious local problems causing the dryness, or if it seems like something more systemic might be going on affecting the glands themselves.
So rule out purely dental issues first.
Yes, a complete dental evaluation is really important for that.
And dentists can offer some immediate help too, right? Not just diagnosis.
Oh, absolutely. Based on what they find, they can recommend specific products, things like saliva substitutes, basically artificial saliva.
Okay.
Special mouth rinses designed just for dry mouth, maybe suggest changes to your brushing or flossing routine to cope better with the lack of saliva.
Good. The sources also talked about getting an accurate diagnosis, which might mean seeing other specialists. How does that usually work? Does the dentist refer you?
Often, yes. If the dentist suspects the dry mouth isn't just a local thing, but maybe linked to one of those medical conditions we discussed.
Like diabetes or Sjogren's?
Exactly. They might refer you on. Perhaps to an oral medicine specialist, they focus specifically on mouth conditions.
Okay.
Or they might suggest you see your primary care physician, who can then investigate or refer you to the right medical specialist, like an endocrinologist for diabetes or a rheumatologist for autoimmune issues.
So it's about finding the root cause.
Absolutely. Getting that accurate diagnosis is really the cornerstone of finding the most effective long-term treatment plan.
Makes sense. Now, beyond the professionals, what about things people can do themselves day to day at home?
Yeah, there are definitely some useful self-care strategies. The sources highlighted several good ones.
Like drinking water. Things obvious, but
It's fundamental. Sipping water frequently throughout the day really helps maintain overall hydration, which supports whatever saliva production you do have.
okay. What else?
Using those over-the-counter saliva substitutes or special moisturizing mouth rinses we mentioned can give temporary relief.
Right.
Chewing sugar-free gum or sucking on sugar-free lozenges can also work for some people. It can actually stimulate your glands to produce a bit more saliva.
Ah, interesting. Anything to avoid?
Yes. Definitely try to limit or avoid things that make dryness worse. That includes alcohol,
Mhm.
tobacco products, and also caffeine. So coffee, tea, some sodas, they can all have a drying effect.
Good tip. And one more.
Using a humidifier,
Uh.
especially in your bedroom at night, adding moisture to the air you breathe while you sleep can really help stop your mouth drying out so much overnight.
That's a great practical tip. And it sounds like this isn't usually a one-and-done fix. Follow-up is important.
Oh, absolutely. Managing dry mouth is often an ongoing thing. So once you have a diagnosis and a plan, regular check-ins with your dentist or doctor are really important
Why is that?
to see how things are going. Is the treatment working? Have your symptoms changed? Do adjustments need to be made? Dry mouth can fluctuate, so keeping that professional oversight is key for the best management over time.
Okay, so summing up, it's really clear that dry mouth xerostomia is, well, it's common.
Okay.
But it can stem from a whole bunch of different things, many of which are, quite a bit more involved than just needing a glass of water.
That's the key takeaway, really. Understanding those potential underlying causes, whether it's meds or a condition like anemia or diabetes or something else, that's the first crucial step towards managing it effectively.
And the big message seems to be, don't just put up with it. Seek professional help.
Absolutely. Start with your dentist, talk to your doctor, get that proper evaluation, and work out a plan that's right for you.
Definitely. Thinking about all these connections we've discussed, meds messing with nerve signals, anemia limiting oxygen, diabetes messing with fluids, radiation damage, the immune system turning on itself. It really makes you wonder, doesn't it? For anyone listening who experiences dry mouth or knows someone who does, what surprising factor, maybe something you hadn't considered before, might actually be playing a role. It's certainly way more complex than it first appears.
It really is. Food for thought.